8 symptoms to pay attention to in the elderly. If you're not paying attention, you may easily miss important symptoms that are signs that there may be something wrong with your elderly loved one. Although it's normal to experience aches when you get older, this doesn't mean that you should ignore all the signs that your body gives you. After all, some may be symptoms of a serious health problem. It's very important that you consult your doctor if you're experiencing strange or recurring symptoms, even if you believe that they're nothing to worry about. Waiting for them to magically go away can be very costly for your health. Unusual breathlessness. Chest pain is just one of many the symptoms of a heart attack. These can vary from one person to another. If you find it hard to catch your breath after a short walk, for example, this may be an early sign that one of your arteries is partially or totally obstructed. This can lead to a heart attack. If you notice that it's very difficult for you to breathe, you should make an appointment with your doctor. Other signs may be chest tightness or dizziness. Sudden dizziness or problems with balance and coordination. The symptoms of a stroke can be very subtle, but, if you know them, you're less likely to ignore them. Sudden difficulty walking and a sudden loss of balance and coordination are symptoms of a stroke in both the elderly and young adults. You should also pay attention to these signs. An extreme sensation of dizziness. Speech difficulties. Badly pronouncing words. Changes in your vision. Weakness or numbness in your face, legs or arms. These are your signs that you have to see a doctor immediately. Vaginal bleeding after menopause. If you experience vaginal bleeding after menopause, it's best to go to your gynecologist as soon as possible, as this isn't normal. Some cases of bleeding may be less severe than others. However, you should consider the possibility that the bleeding could be a symptom of a serious illness such as cancer. You shouldn't take it lightly. Likewise, it's important that you do routine checks, even if you don't experience vaginal bleeding. Erectile dysfunction. This is a condition that's usually very common in the elderly and is more likely to appear as they get older. In fact, about 22 of men aged 60 are impotent. In addition to being an obvious concern when it comes to sexual satisfaction, it can also be associated with heart disease, diabetes, and other conditions. Although its appearance is usually age-related, it can also be caused by increased levels of stress or depression. Pay attention to this symptom, as it could point to more than just aging. Constipation. Constipation causes you to work harder than necessary when you go to the toilet. This increases the chances of you developing hemorrhoids. When constipation is occasional, it can be considered normal, and the elderly may experience it more frequently than expected. It can also be a sign that something is blocking your stool. This could be a tumor, polyp or some other obstruction. When constipation is chronic, this can make it too difficult for feces to be removed, so they become hard. This causes the bowel to fill up and then you simply can't go to the toilet. This is called fecal impaction. If you or your loved one experiences frequent constipation, it's a good idea to see your doctor. Color in your stool. This can vary according to what you consume daily. Iron supplements and anti-diarrhea medications may make your stool darker, for example. Any brown or green in your stool is considered normal. However, if you notice the presence of black or bloody stool, you may be experiencing a symptom of bleeding in the upper gastrointestinal tract. This can be caused by ulcers, hemorrhoids, diverticulitis and other gastrointestinal diseases that require more care in the elderly. Abnormalities in your breasts. Although you can detect breast cancer by noticing certain lumps, there are other symptoms that are less well known. Inflammation. Tenderness or discoloration. Discharge from the nipple. Changes in the skin tone of the breasts. Breast cancer is less common in men than in women, but this doesn't mean they can't suffer from this type of cancer. This is why it's important for both men and women and who experience these symptoms to constantly check themselves. Skin injuries. The development of skin cancer is very common in the elderly. As is well known, this type of cancer can appear regardless of your skin color. Pay close attention to any sudden injury to your skin or to the appearance of moles. This is because skin injuries that are not fully healed can become cancerous. There are a lot of ailments that could put your life at risk if you ignore them. It's important that you constantly pay attention to the small signs your body gives you. Remember that you should always talk to your doctor about any worries you have about any of these symptoms before drawing any conclusions. It goes without saying that it's important to listen to your body and see a doctor whenever necessary, as this will allow you to extend a healthy and happy life.